Living Well with Kentucky One Health, of course, they're one of our partners, and Tyler was you this past month, and we had an opportunity to talk with the people at Kentucky One Health about getting ready for summer to avoid some of those injuries. So take a look at this piece.
Hi, I'm Tyler, and I'm here with Dr. Hecker, and we are here with another installment with the Living Well with Kentucky One Health segment. And as we're approaching summer, I wanted to really get your expertise on some key things everyone should know about and maybe be reminded about as far as being safe this summer and how to really enjoy the summer. So the first thing is I want to talk about a fun activity. Most people love to do it, even if they can't do it. Surrounds water, it's swimming. And that's one of the top 5 leading causes of death over the summer. What do you really suggest people should do as far as being safe this summer when it comes to swimming, and whether they're at the pool or at the lake or on a vacation?
So preparation is key. Teaching your children how to swim, having everyone around ready to watch small children. Age 1 to 4 is your most dangerous group, looking for drowning. So really preparation is key, and then excellent supervision when the children are swimming.
Okay, that's great. So even if they don't drown, tell me, is there any type of effect that happens to a child or an adult if they even almost drown?
Yes. There's what used to be called near drowning immersion injury. It can damage your lungs irreversibly, and yes. So if you swallow a bunch of water, inhale a bunch of water, sometimes we can't get people off the ventilator and they die.
Okay, so that's a very serious fact to know. The next thing is we love swimming, and another thing is biking. We love to swim, but another thing is bicycling. All year round, but specifically in the summer, bicycling fatalities are the highest. Instead of fatalities, what are other injuries that happen with bicycle traumas?
So obviously the head comes first, and so if you're wearing a helmet, you can protect your brain. But even if you're able to do that, you can break any arm, leg, your pelvis. You have internal organ injuries. You can be in a hospital for 3 months. So if you live through a bad bike accident, you're not quite out of the woods yet.
And do you see a lot of that?
Yes, that's kind of how I know I realize that it's summer is when our ER gets busy. We call it the trauma season. And so just kind of when April hits, you have that first warm spring day, we just fill up with trauma patients, bicyclers, four-wheelers, all of that stuff.
So everyone just starts getting out because of the warm weather. And another thing that triggers summer is the warm weather. So do people really need to take precautions as far as the heat is concerned? And what do you suggest for that?
Definitely. That's another one where preparation is key. Planning out your day, planning to drink plenty of water, cover yourself, try not to be out in the middle of the sun during the hottest part of the day, 10 to 2-ish. And again, just being smart about it, avoiding alcohol. That's key really for talking about the trauma, the drowning, the heat. Alcohol and other substance abuse can really impair your ability to protect yourself out there.
And in addition to those that you just spoke about, are there any other injuries that come along with being in the heat too long or too much exposure?
Yeah, we call it heat exhaustion if it's kind of more mild, and then heat stroke, which is more life-threatening. And that, again, substance abuse kind of ties in with that. But we have a lot of patients who come in alive at a temperature of 107, 108, 109, and you just can't get them back. Sometimes it's just beyond help.
Wow, it's nothing I realized. So another thing that, and maybe people just need to hear it again and again, I know I do, sunscreen.
Yes.
What are the rules with sunscreen and the suggestions and the go-tos and the must-dos?
Well, speaking as a parent, I would say just buy as many containers of sunscreen as you can, especially with children. Cover them every couple of hours. They say you should use about a can per person per day of the spray kinds, what we use. But generally, people just don't use enough sunscreen. As little as 30 to 60 minutes out there can cause a severe burn, and they've linked one severe burn in childhood to higher risk of cancer in adulthood. So a little bit of sun is okay, and it can be healthy for vitamin D, but you just got to be really careful.
And just for those out there, and it's my question too, do I require the same amount of sunscreen?
Yes.
For my melanin?
Sure. Well, yeah, everyone does. Yeah. Oh, we can all burn, as I'm sure you know, and it's in where you live has a big factor in how bright the sun is that day. And like you've heard, probably even on overcast days, you can get a pretty good sunburn. So, yeah.
Well, your doctors and staff at the hospital gave us some very useful information.
You want to be active, but you got to be safe.
So important. We'll take another break.